My name is Dr. Mark Connelly, and today we had the privilege of working with Cindy.
My name is Cindy, and I had my crown fixed on my front of my teeth.
Cindy had quite the problem in that she had a loose front tooth that got even looser when she had an accident with her young grandson.
When I was younger, I got hit in the mouth with a softball, so I had root canals and crowns put on my front teeth. My grandson did a flip. He flipped over, and I got his foot. So that made it loose. So this is why I came to Mark.
She came into my office, first of all, looking for a dental implant. And one of the things we have to remember is that a dental implant is just one modality for fixing teeth. Unfortunately, it was not indicated for Cindy, but we were able to help her and get tremendous results by doing a one appointment, 3-unit bridge and a crown, and to beautify her smile.
So what made me do this all in one day today was to get it all to match. Ashlyn was wonderful. She knows her job real well. She's the one that matched up my teeth, told me everything step by step, what was gonna go on, and she made me very comfortable. My first smile after I got my bridge done was I just couldn't stop smiling.
She was ecstatic. She always wanted to have a better looking smile, and we were able to accomplish it in less than 3 hours.
I didn't like to smile as much. They weren't as pretty as they are now.
One of the key pieces of technology that we have in the office is called CEREC. CEREC is one of the original one appointment crown milling machines with digital scanning. I've been doing it for 20 years now. My first one that I did was in January of 2005.
The digital's much better than the traditional. Less painful. Less painful to have the digital.
With Cindy, now the technology has evolved where we can actually do 3-unit bridges, meaning that we can replace a single tooth with a bridge, and we did all this by digitally scanning the impression, so there was no more goop that goes in people's mouth, no temporary that they had to put up with, and they didn't have to take any more time out of their work to come and get the second prosthesis or the porcelain bridge delivered. Beautiful porcelain is what we can provide now with our Prime Scan.
My experience in the procedure was very good. They look nice. They feel great. They explained everything real well, and my experience was really good.
Just to make it clear, what a bridge is 3 crowns all splinted together into one piece. And usually the one in the middle is where the missing tooth is. Now with Cindy, we did more complex treatment because we had to extract the tooth at the same time. We had to do some bone grafting. It involved some very technique-sensitive suturing that I did, but we were able to get it all accomplished. We did use another piece of technology called a dental laser to help reshape the gums so that when everything heals, we have a much more ideal or a much more natural looking smile for her.
Oh, my thoughts on the technology is just great. Everything is digital. It doesn't hurt. State of the art for sure.
For Cindy today, what we ended up doing was a dental bridge, primarily because it was a front tooth and she did not have enough bone to place an implant. And so the teeth on each side of the empty space already had large fillings in or an existing crown, and by doing a bridge on that area, we got a much more pleasing aesthetic result. We were able to help her out by replacing a tooth that was loose and was needed to be extracted. She originally came to the office because she thought the only solution was to have a dental implant done. And while dental implants are a great solution for a missing tooth, they're not the only solution, and sometimes they're not even an option that patients might have. So in Cindy's case, what we ended up doing, to get a very good looking bridge up there and to really enhance her smile was a bridge. The teeth already had large fillings in it, and they also had an old crown that looked out of place. So what we do with a bridge, as in Cindy's case, is that I prepare the teeth on each side of the missing spot, and then with our CEREC unit, we're able to scan the preparations of the teeth, and then we have a mill where we can mill the bridge that fit onto Cindy's teeth. That was all done in one appointment. In addition, we did one additional crown, so we really enhanced her smile by doing the bridge and a crown on top of that, and she was ecstatic.
All the girls are super nice here at Connelly's. All of them are. I'm impressed with the whole dental practice. I would recommend Mark Connelly and the dentist team because they make you very comfortable and they do a great job.
Probably in the long run, and in different solutions with replacing a missing tooth, you can see in this option is that the missing tooth is here, in that we've prepared, what we've done is we've prepared each tooth on the sides of the implant. That is probably the drawback of having a bridge done, but if you've already had a lot of fillings done in the tooth or large areas of decay, a bridge might be a twofer because you're getting teeth that are crowned and then you get a replacement tooth all at the same time. And if you do not have adequate bone for a dental implant, then we may not be able to do it. So when we do an implant, the way most are done is the implant is placed into adequate bone. It's allowed 3 to 4 months to heal. And then we place what's called an abutment on the implant. And from the abutment, which replicates, for example, in a tooth where a crown preparation is done, a porcelain crown is done that fits right over the implant.
If I would recommend anybody, I would recommend them to come here. They do a wonderful job. If anybody's considering a bridge from St. John's, please come see Mark. Great experience. Does a great job here. They look great. I've never had them look so nice my whole life. Thank you, Mark Connelly and the dentist team. I'm ready to go home and smile a whole bunch.